Rhinoplasty, this wonderful operation, is based on changing the shape of the nasal skeleton, cartilages and bones. Finally, the external appearance of the nose is a consequence of the correlation between the new nasal skeleton and the overlying soft tissue and skin. Detailed anatomic analysis of the nose is an essential first step in achieving a successful surgical outcome. So, with careful examination and conclusions coming from analysis of the patient's pre-operative pictures, in most cases it's possible to judge, to estimate position of the cartilages and bones of the external nose quite precisely. It's of the vital importance to define most aspects of distorted anatomy prior to surgical intervention. For the general public, it's mostly cutting of the bump sticking out from the nasal dorsum, but in reality, it is much more complicated. First of all, the external nose is not only a pyramid right in the middle of the face, but it is the first segment of the airway and a very important breathing organ. In my personal approach, septal surgery is fundamentally important for the final result, and it can be the most demanding part of the operation. Nasal septum is a pillar structure of the external nose, and its shape and size has a significant effect on the surface aesthetics. Basically, nasal septum should be straight, dividing the nasal space into two more or less symmetrical cavities. It's not so rare finding twisted nasal septum in my rhinoplasty patients, which is usually main cause of breathing problems. Anatomically, the dorsal and caudal aspect of the nasal septum form an extremely important area that must be treated with special attention. Any aggressive destruction of these of cartilage in these areas leads to unwanted distortion of the nasal shape. This can deproject the nose, change the shape of the nasal columella, or most frequently cause a saddle nose deformity. Surgery of the cartilaginous dorsum is not only an aesthetic issue, it has a strong impact on the nasal function. That is why modern rhinoplasty techniques totally rely on cartilage preservation and reorientation instead of resection. Resection is irreversible and weakens nasal breathing potential. So bony framework of the nasal pyramid is probably one of the most frequently discussed part of the procedure by the patient. In reality, mistake fracturing the nose takes about 5 minutes from 2 hours surgery, being at the same time technically demanding and also functionally important. Incorrect design and placement of the osteotomies can also severely compromise the airways. There are, of course, many things to focus on because the procedure of rhinoplasty is pretty complex. But our main goal is the happiness of our patients, so being aware of all those conditions, having good relation with the patients, we are capable of achieving great results.